Good morning, everyone. As I promised in my last video that I'll be uploading all the useful stuff for your written exam. So here it is. I'll be starting to upload at least 5 pages every day of therapeutic guideline, which is the TG. Okay, so let's start. With the first page, it's principles of diagnosis and management in dental practice. The information included in this topic is appropriate for dental practice only. So what are the principles that you need to follow? First of all, whenever the patient comes to you, you should be able to identify the disease and its cause, which means that you should be able to form a diagnosis of the patient's problem. Then you should provide acute care, which means if the patient is coming with the pain, you should prescribe him some painkiller or you should start some active dental treatment. Address the cause to prevent recurrence, address the effect of the disease, restore normal functioning, monitor healing. It means that you should be continuously reviewing the patient. Provide ongoing monitoring and management, particularly for chronic or recurrent diseases. The process of establishing a diagnosis, how you will form a diagnosis of patient's problem, is by taking thorough history, by doing clinical examination, and by performing clinic diagnostic tests. Thorough history we will take, like for example, for pain we will take all the Socrates, and clinical examination, like we will start from outside the mouth of patient and like look for any sign of swelling or any sign of infection. Then we will check inside the mouth, like hard tissues, soft tissues, and then we will perform the diagnostic test, for example any x-rays if we needed, or any other diagnostic test that we need for the particular problem. The clinician uses, after doing all these information, you should be able to form a diagnosis. Based on a knowledge of oral and dental diseases and the systemic diseases that can manifest in the mouth, clinicians should also consider the possibility that the patient's symptoms may be an adverse effect of a drug. It is usually possible to establish a diagnosis of dental problem before starting treatment. Unless if there is any emergency or acute care is required, you can do the treatment. Okay, so if the diagnosis is not clear in your mind, you should not be treating the patient. Okay, so you should wait until the your test information comes to you, or refer the patient to the specialist for the second opinion. It is essential to identify the cause of the disease before addressing, because addressing the cause is an integral part. Like, what is the cause of the disease? For example, how we address the cause of the disease is by doing the active dental treatment to manage any problem. The cause may be simple, like it might be any caries or any decay in any of the tooth that is causing the pain to the patient, or it might be complex, like something is going inside the patient's body which is showing as an oral manifestation. Complex conditions may require other management in addition to dental treatment, which would be like referral to the medical practitioner or referral to the specialist if there is any complex condition. There are certain risk factors. So there are two things which you need to understand. First is the cause, okay, which is the main part why this thing happened to the patient. And there are certain other factors which are the risk factor of that disease, should be identified and modified if possible as part of the overall management of the patient. For example, if there is any patient coming with the perio condition or the gum condition, we know the cause is the plaque, but how this plaque is happening, you need to find out the risk factor, like any diabetes, smoking, how well he's brushing his teeth, any flossing, family history. So these are all the risk factors. If the cause is not addressed, full or rapid recovery may not be achievable, or an acute condition may progress to become chronic. Once the diagnosis and cause has been established, the clinician should decide an appropriate management strategy. There is a distinction between the management and the treatment. Treatment is only the medical or the surgical care you will provide, but the management is the overall handling of the patient. Like if the patient says that I have this problem, like I cannot come too often, then you need to make your treatment plan according to the patient's need. Drug therapy or the irreversible dental treatment should not be started until the diagnosis has been confirmed, because it would only give the bad effect to the patient's body. Let's try this or just in case is not recommended. You should be so certain with your diagnosis, then only you should treat the patient. Otherwise, you can refer the patient to the specialist for the second opinion. Most conditions that lead patient to visit their dentist require dental or oral treatment. Drugs are usually only needed adjunctively. So it is written that whenever the patient comes to you, so it is a dilemma that patient would also need. Patient would say to you that can you please prescribe me some medication, I do not have time to undergo any dental treatment. But you should be saying that to treat any dental problem, the best thing is to do the active dental treatment, because the drug therapy can only be used adjunctively. All right, so now we will be studying the diagnosis part in detail. Like first part is the taking the history, then examination and diagnosis test. Okay, so in history, when a patient attends a dental practice, establish the reason for their visit, which means the chief concern. Take a dental history which include an overview of patient's previous dental treatment, which means the dental history, if he got any dental treatment done at previous stage and how was his experience, and a detailed history of the presenting complaint, like history of present complaint. This assists with forming a provisional diagnosis. After taking any history, there should be something like a provisional diagnosis in your mind, and then you can direct your tests according to that provisional diagnosis. Like, for example, if the patient gives you any history, like I'm getting, I'm sensitive to hot and cold, and I am, getting the lingering pain. I am not able to sleep at night. So there are certain diagnoses, like in your mind, you might be thinking that it might be a case of irreversible pulpitis. So you should direct your test towards that side. Like you should do the cold test, the X-rays, and all the tests that will help you in reaching to the definitive diagnosis. Okay, so several potential diagnoses might be possible, like the differential diagnosis may be likely. Ask specific questions to narrow the field. Like, for example, you always ask the open ended questions are more effective than the leading question. Like, you should ask, like, what is your problem, or what is the main reason that you came to the dentist, rather than asking like if there is any particular thing that is causing you the pain, like for example any hot or cold. You should not guide the patient, you should just ask him open-endedly. Then the other part of the history is the medical history, which you all know is very important. Okay, so particularly with the children, you should also ask about their age and weight, because we will need to prescribe them some medication, and this could vary. Okay, then you should ask about the medical condition, if they have any pregnancy and breastfeeding status. And a comprehensive medical history includes like if they are taking any prescription medication, over the counter medication, or any non-prescription medication. Like for example, some females may be taking the contraceptive pills, so you can ask that, like if you are taking any prescription or non-prescription medicines. Then other complementary medicines, for example, vitamins, supplements, herbal medicines. Then the smoking status. For the smoking, you should be asking the past and the current, both status. Alcohol intake, use of any illicit drugs, or history of allergies and adverse reaction to drugs. This is very important to know the allergies. Okay, and the other thing is the capacity assessment. You should be able to assess the patient's overall capacity if he is able to give you the accurate history and understand and consent to the treatment or not. Sometimes, like for example, if the patient is taking the diazepam and he's taking for his anxiety and he's taking at much higher level, so his capacity to make the good decision may lower down. So you should be able to understand if the patient is in complete senses and he is able to understand and give consent to the treatment. Consult the patient's carer or medical practitioner or other healthcare practitioner if needed to complete the history. If the patient is unsure of the medicine they are taking, if the patient says to you, I am taking certain medications, but I'm not sure which medications they are, then you can do certain things like ask them to obtain a current list from their medical practitioner, pharmacist, or any electronic health record they have to bring to the next appointment. Cross check the medicine list with the medical history. There may be a condition that the patient may have forgotten, okay, to mention or has not been disclosed. For history taking in relation to use of drug associated with osteonecrosis of the jaw. A complete history also include the social history, which will be mainly the family, occupation, and recreation. At each appointment, check the patient's history for any changes, mainly the medical history. You should always check if there is any changes in your medical history, or if there is, since I saw you last time, or if there is any other update that you want to mention. Okay, then examination and diagnostic tests. Before starting the clinical examination, a provisional diagnosis may be evident. Like for example, here we discuss like after taking the history, you should be able to find make in your mind that there is the patient sign are indicating towards particular diagnosis. Then you can do certain tests. Target the examination and diagnostic test to confirm the diagnosis and identify the tooth or tissue that are affected. Choose tests that are evidence based and will aid in decision making. Always use those tests which are evidence based, okay, and will aid you in decision making. You do not have to do all the tests in every patient. You should always do certain tests which will help you in forming the definitive diagnosis and involve the patient in the decision to undergo a test. Explain them why you are doing this test and what this test will help you in. Diagnostic confirmation is particularly important if the dental treatment required for the provisional diagnosis is irreversible. Okay, so before starting any treatment, it is very important that you make confirm your diagnosis, because if you are going to do any irreversible treatment, for example, the root canal treatment or the tooth extraction, and you are not sure if this is the tooth that is causing you the pain, then you won't be a good dentist, right? However, the clinical benefits of performing a diagnostic test should outweigh any associated risks. Okay, cumulative radiation exposure, particularly in childhood and adolescence, has been associated with an increased incidence of cancer. For example, like we all know that we follow the Alara principle for the X-rays, but still, if we are undertaking the radiation exposure for the childhood and adolescence, there has been associated with an increased incidence of cancer, which means there is still a risk. So always weigh the benefit and the harm. I aim to achieve the lowest possible radiation exposure while maximizing the diagnostic value of the test. The process of rational treatment after taking a patient history, when you have taken the history, you have established a diagnosis and determined the therapeutic objective, like why the patient is here, if there is any pain or if there is any infection, and choose an appropriate treatment and involve the patient in the decision. They have always written this line that involve the patient in the decision. It means you should tell them like, we are going to do this, are you okay with that or what. You should also take their advices or involve them in the discussion, and choose an appropriate treatment, involve the patient. And in dentistry, drugs are usually only an adjunct to dental treatment. So the best treatment for any dental problem is the active dental treatment. Starting treatment involves providing the patient with the information about the condition and the reason for treatment. First, you should tell the patient what is actually happening with them. Performing appropriate oral and dental treatment. Then you should do the active dental treatment. Then, if there is any requirement, you should administer or you should prescribe them some drug therapy. Writing an accurate prescription and providing the patient with the required information. Then you need to tell them that, for example, if you are prescribing them the metronidazole, you should aware them that you do not take alcohol with it, or any ibuprofen. You should also make them aware that do not take any alcohol, because there are some side effects that can happen. And you should be able to write in a accurate prescription that we will study in the next chapter. Then this is the first appointment that you have done. Then in the next appointments, you should be monitoring the progress. Like, you should be continuously reviewing the patient, deciding whether to stop, continue, or change the treatment. Okay, so the role of drugs in the dentistry. Overview of drug use in dental practice. In dental practice, drugs are usually an adjunct to the dental treatment. And they have written this line like many times, that the drug therapy is only the adjunct to the dental treatment. The main focus should be the active dental treatment. Appropriate dental treatment can minimize or avoid the need for drugs. For example, if there is any localized odontogenic infection, there is no need to prescribe the antibiotics. The use of drugs can often be deferred until the response of dental treatment has been reviewed. If drugs are necessary, they are more likely to be effective if the cause of the disease has been addressed and the dental treatment has been provided. So it means if there is a need to prescribe the medicines, then first you should do the active dental treatment and address the cause of the disease. Then they would be more effective. Drug choice is based on certain factors like efficiency, safety, suitability, and the cost. Suitability means there are certain drugs which can, make the patient more side effects, or can make the patient to be more habitual. So we need to always weigh the benefits and harms. Inappropriate prescribing can lead to ineffective or unsafe treatment, exacerbate or prolong the illness, distress or harm the patient. Okay, so if you are prescribing the patient inappropriately, then it would only cause the harm to the patient. Like, it will cause the harm to their body, it will add additional cost, and for the antibiotics, it can lead to antibiotic resistance, which is mainly the community problem, not an individual problem. In Australia, medicine related problems can cause approximately 250,000 hospital admissions annually, and up to 4 lakh presentations to emergency departments annually. So this is just the record that they have mentioned here. This does not include adverse medication event for which the patient does not present to the hospital. Many adverse medications events can be prevented by taking a detailed history and prescribing rationally. So they are just saying that when you are prescribing any drug to the patient, you should be 100% sure that this drug would only benefit the patient. Okay, and you should not prescribe inappropriately. Patients often attend a dental appointment with an expectation of a particular treatment. Like, patients, if they are coming with the pain, they always, ask for any analgesic or any antibiotics. They would do that, which may have been influenced by the advertising